Are psychiatrists doctors? What kind of nonsense is that? Why would someone have to go to medical school just to sit around and talk with people all day? That doesn't make sense at all. So why are they doctors? Why do you have to go to medical school to be a psychiatrist? It really does make a lot of sense. Some quick examples. I was working in an emergency room, psychiatric emergency room. It was a separate psychiatric emergency room. And there was a gentleman who came in, I'm not sure if it was for psychosis, I don't remember what it was for. And I was doing the physicals at that point for the people in the emergency room. And I noticed that his blood work had, one of his muscle enzymes was very high. The CPK was very high. And that turned out to be because the gentleman told us, after he'd been in the emergency room for quite some time, he told us he'd been shot and the bullet was still lodged in his leg. So people can have all kinds of problems that they don't tell you about, and especially psychiatric patients, if they're in a lot of distress, psychotic for instance, they may not even tell you about things like having been shot recently. I think it was just a few days maybe before he came in, he was shot and the bullet was still lodged in his leg. So the physical part is very important if you want to address the psychiatric part, and vice versa. Another example, a patient was very depressed, admitted to a hospital ward for depression, and it turns out her TSH, one of her thyroid hormones, was very high, the thyroid stimulating hormone, which is a sign of low thyroid function, hypothyroidism, which can cause depression. So again, physical, mental, basically two sides of the same issue. Another example recently, actually, this was a gentleman who was I was asked to see the gentleman because he was reportedly depressed, not really talking, not really showing any signs of emotional reaction, no smiling, no laughing. And it turns out the gentleman was confused. He didn't know what day it was, what month it was, where he was. So it can be very confusing to people who do not spend a lot of time with patients necessarily to figure out what's going on. So it is important to look at the mental state of people, and the physical and mental, again, go hand in hand. So they're basically, the physical and mental are two sides of the same coin. For example, if someone's in enormous physical pain, they're not going to be in a good mood, pretty obviously. They're going to be depressed, probably anxious, have trouble sleeping. So the physical pain is going to drive their mental state. And then it's like a circle, because if they're depressed, that doesn't help their physical pain either. So it's a very difficult cycle to break sometimes, unless you can treat the pain effectively, the physical pain effectively. If someone's depressed, they're often not sleeping, not eating well, and then they start having physical issues. They're not getting enough nutrition, and that also, again, in a circle, can affect their mental state. Another example, if someone has had emotional trauma, abuse, serious abuse in childhood, they often cut themselves, not to commit suicide. I mean, they can do that to commit suicide, but often they cut in order to relieve emotional, intense pain. And that's understandable, I think, because that way, if they're having physical pain, that takes them out of their head, takes them away from the psychological consequences of severe emotional trauma, at least for that moment or for a little while. So that's another example of emotional pain and the physical aspect being connected. So psychiatrists are doctors and need to be doctors, and doctors in a way need to be psychiatrists. I remember an example when I was an intern in a psychiatric emergency room, ridiculous example. When I think back of it, I was just, I had blinders on, basically. I was working on the surgical service as an intern. I rotated on surgery as an intern. I did a rotating internship. And I was in the surgical emergency room, and there was a lady who'd been raped, stabbed, and was in the surgical emergency room. And we were treating her for the stab wound. And it didn't even occur to me to call a psychiatrist to see the patient because she'd been raped. So totally ridiculous. You definitely, as any kind of doctor, you want to also not necessarily be a full psychiatrist, but you definitely want to think about the mental part, the emotional part. Another example, psychotherapy. If someone's doing psychotherapy, they still can really benefit from being in tune with the physical aspect and having a medical background, because many psychotherapy patients, even if they're not on psychiatric medicine, they're on other medicine, like for high blood pressure, etc., etc. And many medicines can have psychiatric side effects, psychological side effects, like medicines can cause depression, anxiety, even psychosis. Thank you.